My name is Danielle, and my child's name is Declan.
I'm Christina Bitzer, and my daughter's name is Marlon.
I'm Marianne, and this is my son, James.
I'm Jennifer Sosnowski. I'm a physician here in Phoenix, a family practice physician. And this is one of my two children, Sean, who's 5 months old now.
My first experience with breastfeeding was with my daughter, Ava. And by the time I left the hospital, I was in extreme pain, bleeding, and having to pump and supplement her on formula, and I didn't know what was wrong.
To me, breastfeeding is the #1 priority. It was non-negotiable. I felt that I was a pretty experienced breastfeeding mom. So with Giovanna, I was just really concerned, and I did not want to give up.
We had a very rough start with breastfeeding. I was extremely determined to breastfeed my daughter because I knew how important it was, but it was extremely, extremely painful. Every time she would latch on, I would need my husband to sit right next to me, and I would literally squeeze his hand so tight, his hand would almost fall off. And eventually my husband looked at me and he said, "Honey, you can't go on like this. This is not gonna work. We need to do something."
I remember just calling my husband and crying out of frustration, feeling like I was doing something wrong, and I just didn't know what to do. And so finally, out of desperation, I went to see a lactation consultant to find out, what am I doing wrong? I thought maybe the position was wrong, or there was something I just didn't know. And she was the one who diagnosed that there was a tongue tie issue.
I'm an international board certified lactation consultant, so I've been talking about breastfeeding almost my whole career. For the past 12 years, I've been counseling women on breastfeeding issues and complications, and I never knew that my children would be tongue-tied.
I was very emotional, I was very stressed out, I was crying, I was lashing out on my husband. My mother was in town, I was lashing out on her, and I didn't feel like anybody really understood me.
Every time that I latched her on, I thought, I don't know how much longer I can do this. And if the pain level would have kept up at that point, I don't think that I would have been able to continue doing it.
So when we came to the office, Marlon was fairly calm. Dr. Agarwal explained the procedure to us, and it seriously felt from the time that he explained everything and then he took the baby out to do the procedure, it felt like it was only minutes. And when she came back in, I had to ask, is everything done? Because I had a baby who was happy, she seemed content, and you never would have guessed that anything had happened. So that made me really happy.
The day of the procedure was terrifying. I handed him to Dr. Agarwal, and he took him, and I didn't hear any crying coming from the room, and maybe 5 minutes had passed. And he brought Declan back out to me in his arms, and Declan was fine and smiling, and he said, "Oh, you know, you have such a sweet baby." And he was completely fine. There was no trauma to him at all. He didn't seem fazed by the procedure at all. So I sat down with him and I tried nursing, and I just started crying because there was relief. There was that, oh, this is what it's supposed to feel like.
He did really well. It was mentally, it was challenging getting ready to have your, little baby boy, go through a procedure, and the way, he gets held down. And I remember just going into the restroom and praying because I didn't want to hear him cry. So I remember praying that he'd be okay. And you came out and he was just doing so well. I don't even think he was crying. And that same day I put him on my breast and he started latching on without the clicking noise or without slipping off.
We did the surgery and he immediately latched on and was able to breastfeed much more efficiently. In fact, he was able to get it done in 5 minutes flat on each side. He gained weight and he did wonderfully. I was able to breastfeed him until about 18 months of age.
After the initial tongue tie procedure, it was amazing. He went from taking an hour and a half to eat to taking 10 minutes. which was life-changing in the household.
We were sitting downstairs just watching TV, and all of a sudden she just starts like bobbing her head towards my breast. I'm like, what are she doing? I literally said, I know she does not want my breast. I know, I said, let me just see, because there's just no way that this girl is getting ready to breastfeed right now. I pull up my shirt, and she just started to breastfeed. And I just couldn't believe that. And then from that point on, it was like Valentine's Day weekend. She hasn't stopped.
It's a miracle to have professionals who know what to do and help fix things that it seems so small, but it's just huge in our life and in these kids' lives. They probably don't understand or recognize it, obviously, but we sure do, because we see the effect. And as a husband, I see the effect because when mama's not feeling good, no one's feeling good.
Hello, my name is Rajeev Agarwal, and I'm one of the pediatricians at Agave Pediatrics. We at Agave Pediatrics are strong advocates for breastfeeding. We believe that is the best nutrition for your baby. There have been numerous studies which show that breastfeeding impacts the global health of children. It increases their IQ by as much as 10 points, decreases allergies, increases their immunity, and is very good and balanced nutrition for babies. One of the biggest impediments for breastfeeding is presence of a tongue tie and or a lip tie. In our office, we've taken the steps to diagnose and treat babies with lip ties and tongue ties to improve breastfeeding and to make sure that they don't have any future problems. Tongue ties have been a very common procedures which have been performed all over the world for a very long time. During my medical school in India, it was a procedure routinely done by midwives, physicians, and anybody who was taking care of babies. When I came to the US, I almost forgot about this procedure because I did not see anybody performing it. I realized that was one of the biggest impediments to breastfeeding, and there was no solution to it at that time. I re-educated myself about the procedure and I started performing them. I treated my first patient in the United States with tongue tie in 2007. I soon realized there were a lot of mothers who were suffering with the same issue and needed some help. Because of the success of my first procedure and many more since then, I've made it my goal to spread the awareness to pediatricians, the lactation consultants, doulas, midwives, chiropractors, and everybody who helps mothers in the process of breastfeeding.